Welcome to Pediatrics by Dr. Ashok Nanda. Welcome to this topic-wise MCQs and one-liners. Today's topic is rabies. Let's start. Nibble, cuts, and scratches without oozing of blood comes under which category of wound? In case of rabies, the exposure is category 1, 2, or 3. It is category 2. Coming to the classification, Cat 1, licks on unbroken skin, touching or feeding the animals. No treatment required. Cat 2, nibble, cut, scratches without oozing of blood. That is Cat 2. In that case, what we'll do local wound care plus anti-rabies vaccine. Cat 3, licks on mucous membrane or broken skin, bites with breach of skin and bleeding. When bleeding is there, that is Cat 3. Local wound care plus local rabies vaccine plus rabies immunoglobulin or rabies monoclonal antibody. These are the treatment options for Cat 3. Everything we have to do. For Cat 2, only local wound care and anti-rabies vaccine. Cat 1, nothing to be done. Next, spirit test is positive in Cat 3 wounds. What is spirit test? If at all any doubt, we'll just take some spirit in a cotton, we'll rub it over the scratch area. If suppose there is some burning sensation, then that is spirit test is positive and that is Cat 3 wound, and accordingly we have to react. Management wide, extensive and thorough wound washing with soap and running water for 10 minutes followed by application with 70% alcohol or povidone iodine plus rabies immunoglobulin or monoclonal antibody if indicated plus anti-rabies vaccination. Every time we have to give anti-rabies vaccination. Schedule is 0, 3, 7, 14 and 28. This we have to remember. Next, monoclonal antibodies. Two types, RABIES and twin RAB. RABIES is your human recombinant monoclonal antibody. Dose is 3.33 international unit per kg. In case of twin RAB, that is 2-murin monoclonal antibody, docarbimab and microbimab. Dose is 40 international unit per kg. RABIES is 3.33 international unit per kg, but twin RAB is 40 international unit per kg. Both are your monoclonal antibodies. Next, rabies immunoglobulin, human and equine. Human one dose is 20 IU per kg, equine is 40 IU per kg. No skin testing is required prior to giving to your rabies immunoglobulin. Whatever, if you are confirmed that this is category 3 bite, we have to give, you have to give. No need to go for skin test. Next, which among the following exposure does not need anti-rabies vaccination? Bites by mongoose, bites by domestic rodent, bites by unknown animals. The answer is bites by your domestic rodents does not need your anti-rabies vaccination. All of the wild animals, dogs, pigs, cows, buffalo, sheep, goat, in all the cases, including mongoose, bear, we need to give rabies anti-rabies vaccination. Exposure to bats doesn't warrant PEP in India. In India, exposure bat does not do. We need not give PEP in India. Next, post-exposure prophylaxis of ARV. As per IAP-SCVIP recommendation, IM doses to be given 0, 3, 7, 14 and day 28. This we have to remember. There are so many schedules, but in order to avoid confusions, they have recommended one single, easy to remember, IM doses on 0, 3, 7, 14 and 28. Day 0 is day of when the day when you are giving the vaccine. It is not the day of bite. It is the or exposure. It is the day on which you are giving the vaccine. Most interruption in the vaccine schedule do not require reinitiation of entire series. Suppose somebody has come on day 3, somebody has come on day 4, day 5 like that. We need not restart the schedule. We can give on day 5 itself. We can give the day 3 dose, and accordingly next dose is to be calculated. Next, re-exposure prophylaxis. Repeat exposure less than 3 months after complete PEP, then no need to give further anti-rabies vaccination. Only local wound care is needed. Repeat exposure more than 3 months after the first dose of last PEP, then 2 doses on day 0 and day 3. This we have to remember. Less than 3 months of complete schedule, then only wound care. More than 3 months after the first dose of the last PEP, 2 IM doses on day 0 and day 3. Rabies immunoglobulin is not indicated. pre-exposure prophylaxis. Suppose you want to protect ourselves, then 2 doses to be given IM on day 0 and day 7. Post-exposure is day 0 and 3, but pre-exposure is day 0 and day 7. For re-exposure occurring in 3 or more months of completed and documented pre or post exposure vaccines, only 2 doses to be given on day 0 and 3. Suppose somebody has taken 3 doses, somebody has get 2, the 3-month rule is applicable only if patient has received 3 or more doses of the vaccine. Suppose somebody has taken 3, 4 or 5, at least 3 doses if somebody has taken, then we can, the 3 months rule would be applicable. Then for re-exposure within 3 months of completed and documented pre or post exposure prophylaxis, only 2 doses, day 0 and day 3. This we have to remember. Rabies immunoglobulin should not be used during re-exposure prophylaxis. No question of rabies immunoglobulin when there is a re-exposure prophylaxis. Only rabies, only fresh case we can give rabies immunoglobulin. So important something to be remembered. Your cat 2 is scratches or nibble or cuts without oozing. Suppose oozing is there, then cat 3. If cat 2, then local wound care and anti-rabies vaccines. No question of immunoglobulin or monoclonal antibody. Suppose cat 3, then rabies immunoglobulin and monoclonal antibody to be given. Monoclonal spirit test is positive in cat 3. Management, local wound care plus immunoglobulin oblique monoclonal antibody plus anti-rabies vaccine. Every time anti-rabies vaccination has to be given doses 0, 3, 7, 14 and 28. Next, monoclonal antibody Rabicillin 2-in-1. Rabicillin is your human recombinant 3.33 IU per kg. 2-in-1 is murine monoclonal antibody, dose is 40 IU per kg. Next, rabies immunoglobulin, human is 20 and equine is 40 IU per kg. No skin testing is required. And bites by all except your domestic rodents, and in India, exposure to bat, you does not need your post-exposure prophylaxis. Next, post-exposure prophylaxis, as per IUPAC CVIP, IM doses 0, 3, 7, 14 and 28. Interruption in the vaccine schedule do not require reinitiation of the entire series. Re-exposure, repeat exposure less than 3 months, only wound care. More than 3 months, 2 IM doses on day 0 and day 3. And rabies immunoglobulin is not indicated in case of re-exposure prophylaxis. Pre-exposure prophylaxis, 2 doses, day 0 and day 7. This we have to remember. 3-month rule applicable only if somebody has received 3 or more doses of the vaccine. And rabies immunity is not required whenever there is a re-exposure prophylaxis. Thank you.